My name is Winnie Apio. I'm from Uganda Youth and Adolescents Health Forum. I work as the program manager. And it is quite an honor to have each and every one of you here with us. Just as we are starting, right before I get into talking about what the webinar is about and giving us some of the ground rules and objectives of this webinar, perhaps since we are just about 21 participants so far, I would like to take the opportunity to then ask us if we can maybe just say hi, where we're from, and perhaps something fun or something that you're looking forward to as regards this webinar. So maybe I'll call out the names just so it's in order. Batambuze Waiswa, I already introduced you, but yeah, could you say something? Hello? Okay. Hello, can you guys hear me? Okay.
Yes, we can hear you.
Yes, I've unmuted everyone. I was trying to say, if we can just have brief introductions around the house.
We can hear you, Winnie. Just go ahead.
Yes, I have just asked if people could introduce themselves.
Starting with anyone?
Okay. Yes, I was reading out, but I'm not sure if my sound was good enough. I have a list. So since you have the mic, Lilibet, go ahead.
Hi, everyone. I'm Lilibet Namakula, and I am the Programs Coordinator at Public Health Ambassador at Uganda. Yeah.
Great.
Hello, everyone.
Next to Lilibet, I see Bridget.
Thanks.
Please go on.
Hello.
Hi, everyone.
Hi. Okay, so
Hi, everyone.
Winnie, I wanted to propose that in the interest of time, maybe we could have people introduce themselves by the chat box, just by writing your name and your organization, maybe possibly your title, such that we don't. We have everyone on mute. I was proposing we have everyone on mute, apart from the speakers.
I'm going to mute everyone.
Yes,
sure.
and then people introduce themselves by just typing in the chat box your name and your organization, and then proceed with the call. Otherwise, we won't finish introduction because people are joining.
Okay, thanks, Patrick, for that. So I have unmuted everyone. Sorry, I've muted everyone. As Patrick has suggested, please go ahead and introduce yourselves over the chat. And so we just know who is part of this discussion. So once again, you're all very welcome to this webinar on understanding unique menstrual health and management needs and challenges for girls and efforts to address them. The webinar is scheduled to take 1.5 hours, and so it should be done by 5:30 p.m. And we are very, very honored to have you on the call here. Now, for those who are just joining us, my name again is Apio Winnie from Uganda Youth and Adolescents Health Forum. and which is a youth-led and youth-focused organization that is focused on advancing the rights of women and girls to be able to live quality lives. And MHM particularly is something that we are very, very passionate about. Now, as a build-up to the World Menstrual Hygiene Day on 28th May, Uganda Youth and Adolescents Health Forum and the Ministry of Education is working together to have this webinar. And the overall goal of this webinar is to draw like-minded CSOs, SRHR, gender equality and women's rights activists into conversations on creating a Ugandan society in which every woman and girl is empowered to manage her menstruation safely, hygienically, with confidence and without shame, and where no girl is limited by her periods. The objectives of this webinar is to break the silence, raise awareness, and change negative social norms around MHM, and to be able to engage decision makers to increase the political priority and catalyze action for MHM at national and local levels. Yes, we are very privileged to have a very knowledgeable and skilled panel of speakers today, and I will let them introduce themselves a bit later, but just to go through their names. We have Rosette Nanyanzi from Ministry of Education. We have Mary Namwebe from UNICEF Uganda. We have Caesar Chimbugwe from Water Aid Uganda, Lilibet Namakula from Public Health Ambassadors Uganda, as well as Puleng Letsi from African Coalition for Menstrual Health Management. Now, at this point, I would have gone through some of the ground rules. So I can be able to control your microphones from this side, but in the event that you might unmute yourself, knowingly or otherwise, just as quorum, I would like to ask that we have all our microphones unmuted, just to allow for prevention of all the background noise as you're joining. I would also like to ask that if you have any questions, we'll be addressing questions towards the end of the webinar, but please feel free, as the panelists are speaking, you're still free to go to the chat and ask your questions there, and we can be able to keep track of them and ensure that they are addressed at the end of the session when we're addressing questions and answers. So at this point, I would just like to now call in our panelists to give a brief introduction so that we get right into the discussion today. So if you can unmute and speak. Lilibet, would you like to go first?
Again. Hi, everyone. Thank you for taking the time to join us today. My name is Lilibet Namakula, and I'm the Programs Coordinator at Public Health Ambassadors Uganda.
Hello, everyone. My name is Rosette Nanyanzi,
yes, thank you so
and
much,
I work with the Ministry of
Lilibet.
Education and Sport.
Rosette.
And I'm glad to be here with you today to discuss this very important issue of menstrual hygiene management in Uganda. Thank you.
Hello, everyone.
Thank you, Rosette. It's an honor to have you. Mary?
Yes, hello, everyone. My name
Mary.
is Mary Namwebe. I work with UNICEF Uganda as a WASH officer.
Yes, thank you, Mary. Caesar?
Okay, hi everyone. I'm Puleng Letsi, and I am the coordinator for menstrual health management.
Hello,
and the
Caesar?
African Coalition for Menstrual Health Management, based in UNFPA in East and Southern Africa Regional Office. Thank you.
Thank you, Puleng. And finally, Caesar? Hello, Caesar, can you hear us? Hello? I can see that you're speaking, Caesar, but we can't hear you. Okay. Hello, Caesar? Okay, just as we are waiting for Caesar it seems like he has a technical difficulty with his microphone. Hello? Sorry. Yes, so once again, this webinar is we really want to try and understand the unique menstrual health and management needs and challenges for girls, and what the efforts that either of us are doing to ensure that we address them. One, as a foundation to the MHM Day on 28th May that's coming up, and that offers us a global advocacy platform to consolidate all these different voices and actions of CSOs, to have one collective voice towards advocating for a world where girls are able to experience their menstruation with dignity. Additionally, I'm so sorry, I would like to request again, if you can, please mute your microphone. Okay, just for purposes of this call, I'm going to mute everyone again, and then I will unmute the speakers as and when they need to speak. Also, key to this discussion is going to be how we can ensure that MHM strategies towards MHM management and still advocating for a girl's right to experience her menstruation with dignity is still kept at the forefront of our programming, especially as regards COVID-19 response. So we shall also have discussions around that. So if you have any questions to that regard, please feel free to go ahead and type them out, and we'll see how to address them. So to just begin our discussion, it's very key to understand exactly what are some of the challenges that girls face when it comes to menstruation. And I would like to pull in Lilibet to take that question first. If you can just share with us, based on your experience, what are some of the challenges that girls face as regards menstruation, both in school and out of school? Yes, Lilibet.
Okay, thank you, Winnie. I hope everyone can hear me.
Yes.
Okay. Based on my experience, there's a number of challenges that young people face when they're experiencing menstruation, and majority of these challenges are all rotate around 4 areas. First, in terms of adequacy, acceptability, and affordability of menstrual management materials and products. The second one, under accessibility to adequate facilities, sanitation, infrastructure, and supplies that will enable girls to change and dispose of menstrual materials. The third one is insufficient knowledge on menstruation and the options that are available for menstrual hygiene management. And lastly, which is I think the most common, is the persisting taboos, the stigma, and the discriminatory culture norms and practices attached to menstruation. In my experience, those are the 4 major areas that create challenges for young women and girls.
Yeah, and is it possible to explain the discrepancy between, you know, the girls who are in school as well as those who are out of school, just to give us a comprehensive understanding of the issue and some of the problems that they face?
When I highlighted these 4 areas, I did pick things that affected both girls that were both in school and out of school. For example, if you're looking at girls that are outside of school, then they're majorly affected by is that someone else talking? I don't know. I hear some interference. Sorry. Should I just keep going?
Sorry about that. Yes, please.
Sorry?
Sorry, Lilibet.
Whitney, I can hardly hear you.
Can you hear me now? I'm so sorry. Someone joined the call and did not mute their mic, so that's it.
Okay, so should I continue?
Okay, Lilibet, if you can unmute. I've muted everyone, so you're good to go now.
It says I'm unmuted now.
Yes, now you're fine.
All right. So as I was saying, the 4 challenges that I've highlighted majorly affect both the girls in and out of school. Both the girls in and out of school have issues when it comes to how adequate are the products that they have. How acceptable are they? Some people use the pads and they burn. Some people use the pads and they don't burn, or they smell, or whatever. So we look at the adequacy, the acceptability, and the affordability. And that affects both the girls that are in and out of school. Some goes with the accessibility to adequate facilities, sanitation, infrastructure, and supplies.
Yes.
Yeah.
Okay. Thank you, Lilibet. Thank you so much for that. I was trying to probe sort of like a more broad explanation of that. Okay. So having that background from Lilibet on challenges of accessibility, affordability, as well as adequacy of menstrual health materials, or in general the experience for girls. I also wanted to take note of the fact that there's usually women and girls who are either often forgotten or not prioritized to the point that they need to be, especially when it comes to girls who are either in vulnerable settings like refugee settlements, or in settings that are rural and hard to reach. So I would just like to call in Mary from UNICEF to sort of throw more light on, based on what Lilibet has shared, are there even more additional unique challenges that girls in vulnerable settings face, and how is it that UNICEF or other organizations in that field can be able to address these challenges? Mary. Mary, you can unmute.
Okay. I'll talk about the challenges at 2 levels. One, I'll start with the community level, but it all links to the 4 aspects that the previous colleague talked about. One specifically is the lack of access to appropriate and hygienic materials to use during menstruation. We do understand that the girls use different materials from dirty old clothes, banana fibers, then others are also required to sit in the sand, among others, which all pose a health risk to the girls. Then the other challenge is that in some cases, the girls are lured into act like sex in exchange or promise to provide sanitary pads, which in turn also leads to other issues like teenage pregnancy and also acquiring of sexually transmitted infections. I would also like to emphasize that another persistent challenge is the issue of taboos and myths related to menstrual hygiene, which really hinder the girls to manage their menstruation with dignity. We've heard of myths like when you get your first period, it means you are ready for marriage. Menstruation is a curse. Menstruation is dirty and unclean. If you delay to have menstruation by the age of 16, it means you are barren. So with all such myths and taboos surrounding menstruation, it makes it difficult for girls to manage their menstruation with dignity. Therefore, more work is required to break such taboos. Then the sanitary pads available in the market in most cases are unaffordable, and in some cases they're inaccessible. The supply chain is not well developed. Then there is an issue to do with the limited awareness on how to manage menstruation and the expected body changes among the girls. Specifically at the school level, UNICEF carried out a baseline survey in West Nile and also Karamoja region. And what we discovered is that almost 98% of all government-aided schools were of mixed gender, implying we have both boys and girls, and 82% of the girls are in upper primary are of menstruation age. That implies that there is a big challenge relating to the provision of menstrual hygiene facilities in schools. The key challenge here is that we noted that less than 20% of the girls had menstrual hygiene facilities in those schools. For example, changing rooms, bathrooms, disposal bins, and also incinerators. Also, it's worth noting that even for those schools that had facilities, the majority were not really functioning well because of lack of supplies and other related facilities like basins, water, soap, observation of privacy for the washrooms, and hence they did not meet the minimum standard. Then, which is also common for both schools and the community, there is a general lack of knowledge and skills on MHM. And also uniquely, we noted that there are some schools where they don't have female teachers. And in that case, it's the male teachers that have been designated to perform that role. And that makes it very difficult for the adolescent girls to close up and open up to the male teachers. So as UNICEF, we are working closely with Ministry of Education, the district local government, and the CSO partners to ensure that we address some of the above bottlenecks. Specifically, we have worked with the Ministry of Education Construction Unit to design an adolescent and child-friendly latrine. And this facility basically provides for a washroom where water is installed to ensure that there is easy access. The girls don't have to fetch water from a borehole, but there is a tap within that washroom. It observes privacy, there is a door, and is spacious enough to enable the girl to change with ease. Then also within that latrine, there is a mass hand washing facility which enables multiple users to wash hands and keep hygienic at all times after using the latrine. Some of these latrines have been constructed in West Nile and Karamoja as a pilot, and we expect a lot of lessons from there to ensure that we share at the national and also regional levels. Then secondly, UNICEF has collaborated with the ministry to collect data on WASH from all government-aided schools in the country. And that data also provides information on menstrual hygiene management parameters. For example, we are looking at schools that have incinerators, schools that are providing sanitary materials, schools with changing room, and schools that have a designated senior woman teacher as part of the MHM data. And we expect that this data will be consolidated at the national level along other WASH parameters so that we are able to understand the menstrual hygiene management gaps and plan for the required investment at the national level. Then UNICEF has also collaborated with the gender unit, CSO partners, and the district local government to train senior women teachers, parent teachers associations, school management committees, and school health clubs on menstrual hygiene management, with the aim of ensuring that adolescent girls acquire the required knowledge and skills, but also to empower the schools to be in position to plan, budget, and implement menstrual hygiene management activities. It's also important to note that the girls have been supported to acquire knowledge on how to make their own reusable sanitary pads in order to manage menstruation with dignity, having noted issues of affordability and accessibility in relation to the sanitary pads. Thank you.
Thank you so much for that, Mary. And you did bring out some very key points as regards the challenges that girls are facing, but then also I like that you highlighted the evidence that you used to find out some of these challenges, the surveys, as well as the data on WASH. And just as a segue to the next question, I wanted to ask Caesar. We've had Mary highlight some of the research that they have carried out with UNICEF. But then I wanted to find out from Caesar. Just a minute, I'm going to mute everyone and then. What? Hello, Caesar. I'd like to
can you hear me now?
Yes, okay, yes, we can finally hear you. Since you didn't get the opportunity to introduce yourself in the beginning, perhaps you could just give us a brief introduction of yourself, but then also just to highlight whether there is more available evidence on some of the challenges that have already been highlighted by the previous panelists. But then also, how can we access, as organizations that are passionate about advancing the rights of women and girls to experience their menstruation with dignity, how can we utilize and access the already existing evidence?
Thank you very much, and thank you very much to the previous speakers. My name is Caesar Chimbugwe. I work with Water Aid in Uganda. The challenge of data is not MHM alone. I think performance monitoring data across board has been such a big challenge in terms of accessing it, but also making sense out of this data to inform both operational and strategic decision making across the. Here we're dealing. Where is the data? Because definitely across different, but also including civil. Nationally, MHM, as perhaps even elsewhere in other countries, is a cross-cutting issue, mainly in sectors of gender and if they have
Sorry, Caesar, we lost you.
the beginning of the challenge, that the management information systems within these different sectors that capture
Hello, Caesar. Hello, Caesar. Okay, it seems quite unfortunate that I think his connection is a bit bad. But once he's back, I will definitely draw him back, because I think evidence is quite important in our work, and for us to understand exactly how we can better document, but also better have better knowledge management in MHM programming. Now, taking note of the different interventions that have been spoken about, and then also the different challenges that have been highlighted that girls face in the communities and even in school. As the Ministry of Education and Sports, I would like to pass the mic to Rosette. Is there anything that the ministry has put in place to be able to ensure that all these different players, is Caesar? Yes, back to Rosette. Sorry about that.
Sorry, I went off. I don't know if
Okay.
you can hear me now.
Yes, we can hear you now.
Yeah, apologies. So I was explaining the
yeah.
complexity of the monitoring systems that we have across the different sectors that deal with MHM. And in addition to the line ministries that are handling MHM issues, we also have the local authorities. In Uganda, for instance, we have Kampala Capital City Authority, that is a major player when it comes to public schools that are challenged with MHM. So we have isolated data across all these institutions, but also have the national statistics body, the Uganda Bureau of Statistics, which should be communicating national statistics on MHM and the other aspects of development. So what I want to highlight in all this is that the problem is not having the data, but data that is not centralized, and data that is we cannot communicate harmonized information when it comes to dealing with MHM. So that's the biggest challenge. And globally, I think the GMP through UNICEF and WHO have really tried to have this consolidation in different countries, and Uganda participated in that survey that produced the GMP report 2017 that captures the status on the SDG indicators. So that is pretty good, but nationally there's still lots of gaps in terms of having centralized data on this. Thank you very much.
Thank you for that. And I think you spoke right into what we were trying to address when you dropped off the call. Having centralized data means there needs to be more central coordination. And you spoke about the role of the ministries as well as local community players. And I guess at this point, I would like to then go back to the question that I had posed to Rosette. If there is something that the Ministry of Education and Sports is doing to ensure effective coordination of all these different players in the field of MHM across the country. So I'm pulling in Rosette.
Thank you very much. My name is Rosette once again from the Ministry of Education and Sports. And I would like to say that the Ministry of Education since 2014, is the chair and the convener of a national coalition for MHM partners in Uganda. This coalition has membership of ministries, departments and agencies, of government, development partners, civil society organizations, and faith-based organizations. For us to be able to bring all these people together, we meet on a quarterly basis to discuss the key issues that are coming out from the interventions that each one of us is implementing. And as a coordinator, we've been able to ensure that we harmonize what is being delivered out there. Our first presenter talked about the issue of knowledge and information concerning MHM. And for us as a sector to make sure that we harmonize on what is being delivered out there, we've been able to develop training, manuals, readers, and video animations on MHM as a subject to make sure that whoever goes out is delivering the same kind of information to our public. In addition to that, as a sector, we have developed a national guideline for menstrual hygiene management in schools. Again, we believe that once there is a national guide, we'll be able to harmoniously handle our work and be able to deliver information that is right for our children. We have built the capacity of our teachers, learners, civil society organizations, and all other partners working on menstrual hygiene management. And this is in line with our manuals. We don't want people to go out and deliver different content. As you are all aware, menstrual hygiene management is also a sexual and reproductive health issue. And there is a lot of information that may not be right to our people. That is why we've been able to develop these training manuals to make sure that we are able to have harmonized information. On the side of policies, we have made sure that menstrual hygiene management is integrated in our policies right from the national level. The national development plan that is coming to an end, we made sure that MHM was integrated, but also in 2015, we sent out a circular at all our schools and institutions on how menstruation should be managed. Then we have integrated menstruation into the sexuality education framework, which was launched last year. And of course, we have also been able to integrate MHM in our lower secondary curriculum, which is now being implemented. And then, of course, it is also integrated in the draft school health policy. Unfortunately, this policy would have been passed around this time, but because of what is going on right now, this policy is still out there. But the moment the lockdown is closed, then we shall be able to present to the country our school health policy. And this has taken care of our MHM. We have been able to register a number of successes, and we are proud to say that as a sector, menstruation has been brought to the attention of the policymakers right from Parliament. As you are aware, it is one of the issues that was raised in the presidential manifesto. Like Mary already shared, we have been able to engender our construction facilities, especially our new facilities, with gender-responsive facilities that take care of menstrual hygiene management. On the issue of addressing the norms and practices out there that are negative, we are engaging with the cultural and religious leaders still to be able to discuss these issues. And we have had district dialogues on creating safe learning environments, and of course, mobilizing resources to support menstrual hygiene programming. Recent, we got funding from the Global Fund for HIV, and we are targeting adolescent girls aged 10 to 19. And we shall be providing sanitary pads and other subsidies to almost 12,000 girls in some of those most vulnerable communities. And we believe that this is something that we can be proud to talk about. But we have bottlenecks. At the national level, we have failed to have, we still don't have a strategic plan or an investment plan. And of course, without this, it leads to limited funding of MHM activities across the country. I remember the previous speakers also talked about the issue of access to facilities. When we don't have a plan in place, then it becomes very difficult for us to mobilize resources. And then the other issue is the issue of indicators. How do we measure what we do? As a sector, we have not yet included indicators in our EMIS, but I also believe that equally other sectors, key sectors like Ministry of Health, Ministry of Gender, Ministry of Water and Environment, have not put in place a framework to measure what they are doing with MHM. And I think this affects our interventions. Yes, we have done too much as a country, but when it comes to evaluating our interventions, I think we have a gap with data. And of course, the issue of, we still have the deep-rooted norms and cultural practices around us concerning menstruation. Maggie has already talked about the implication of this. In some communities, when the girl is has started menstruation, they will say, you are now a woman, then you cannot sleep in your father's home. So eventually you end up getting pregnant or you're staying out with your auntie and she marries you off. So these are challenges that we are grappling with, but we believe that this can be addressed if we put our heads together. I also want to talk briefly about what is happening now. In this COVID pandemic, I think the issue of menstruation has not been given the due attention it requires in this period. I've seen many agencies providing food, soap, mattresses, sanitizers, but I'm wondering who is talking about issues of sanitary pads, especially to the people who are at the front line of addressing this issue, who are mainly women, but also we should be mindful of our girls that are already at home. What are we doing? I appreciate that families right now are struggling to provide the basic needs, but I'm wondering, are the families considering sanitary pads as a basic need to our girls? I think this is an issue that we really need to raise, but besides what we are going through, our girls are still menstruating and we need to do something. I submit.
Rosette.
Yes.
Rosette. This is Albert.
Yes, I can hear you.
Sorry. No, it's fine. Rosette, we'll have Albert. Thank you for that. We'll have questions directed at the end, just so we can be able to finish. So please, there's a chat if you can see. Please feel free to type in your questions. We are keeping track of them, and we shall have them addressed at the end. Thank you so much for that, Rosette. You have hit on the reiteration of the need for data, the huge gap when it comes to data as regards MHM programming, which Cesar also pointed out earlier on, and also talked about the deep-rooted cultures, which is also a reiteration of what both Mary and Lilibet spoke of in the beginning. As regards COVID, we are going to have, we hope that this webinar is also going to be a point of discussion on, as civil society organizations, how can we come to the forefront and ensure that the efforts that we've already made in ensuring that girls experience menstruation with dignity are not suddenly eroded due to unforeseen challenges that the COVID response has brought in. So thank you so much for that, Rosetta, again, and we will definitely be addressing that, having a wider discussion on that later on during the webinar. To this point, I would just want to know from, I'm so sorry, there's a problem with the connection, from Puleng. We've had Rosette talk about some of the bottlenecks that, Ministry of Education and Sports is already doing a great job having a coalition that speaks, a coordinating body that's already trying to see how to bring these different organizations together to ensure that we have more focused work and more coordinated, better coordinated work. So we would like to hear from you from a wider perspective about some of the experiences of the African Coalition of MHM. How is it that you are ensuring that coordination is done so much better, and what are some lessons that we can pick from you based on your experience with other countries?
Thank you very much, Puleng here. As the African Coalition, we do recognize that there is a lot happening in terms of menstrual health management or menstrual health and hygiene in the different countries. And what we aim to do as a direct result from the 2018 East and Southern Africa Symposium, which called for the African Coalition and mainly to strengthen the coordination and collaboration among key stakeholders. We aim to strengthen this collaboration and coordination among stakeholders by enhancing collaborative partnerships amongst the stakeholders, and these are different groups from civil society organizations, governments, private sector, social entrepreneurs, and even individuals who have a stake and are interested and are doing something on menstrual health management. So we do this through joint actions, through joint resource mobilization, through joint advocacy for menstrual health-related policies towards effective, sustainable MHM in Africa. So we build on the existing evidence, and we support the evidence base to really transition research into action and vice versa. So we aim to link policy, programming, strategies, and implementation on the ground, while we support multi-sectoral policy making. The key issue is also to be able to document some of the successes and implementation on the ground, to realize what can be scaled up and build on the evidence, so that we have sustainable programs that address the menstrual health management needs of people who menstruate throughout their menstrual life cycle on the continent. So we do believe that MHM is an essential requirement for African countries to harness the demographic evidence and to achieve the commitments that have been made. And we do this through different avenues and strategies. We do some mapping of what is happening on the ground in terms of policy, programming strategies. We do some stock taking. We have, through this coalition, created a platform for advocacy and dialogue. So even though we are a structure, we heavily rely on all members and interested parties to have this vibrant platform for advocacy and dialogue. Through our members, we support the development, implementation, coordination of regional guidance and standards on menstrual health, while we continue to foster evidence generation and knowledge sharing. And I must emphasize here that knowledge sharing is our key strength, as well as partnerships development and strengthening, because a coalition is a coalition because of the members, because of the partnerships, because of the collaboration that happens. And we continue to monitor what is going on and work with different partners and countries to be able to set up systems and structures and strategies for M&E and tapping on the research that is out there. So we are coordinated or structured in a way that we have what we call our task forces, which are thematic, and we have people working on MHM and sexual and reproductive health and rights, MHM in education, MHM in water sanitation and waste disposal, MHM in humanitarian settings. We're working on MHM in marginalized groups, as well as the development of standards for sanitary products and value chain. And amongst all these, we have some cross-cutting initiatives or issues, which include research and M&E. And really, the membership for the coalition is open, as this coalition is governed as a multi-sectoral collaborative network of organizations and people which who have an interest, and we comprise different areas, like I said, government, private sector, young people, youth representatives, and civil society organizations. So we have managed to do a lot of good work through this collaborative partnerships and networking. And in the past year, we've seen issues around tax issues, we've seen policy development, we've seen political leadership being enhanced, and the development of standards, just to mention a few. So we believe that it is through the joint collaboration and partnerships that we are seeing the traction that we are seeing in the African region. In the interest of time, I'll stop here, but there's more to share in terms of the successes that we have achieved, and we were happy to share some of those. Thank you very much. Hello?
Sorry about that. Puleng, thank you so much for that. I was just asking, as civil society organizations, how can we be able to join the coalition? You said it's open, but is there like a procedure that we can follow?
Okay. Thanks a lot. The membership is very open. So what we do is that you can join either through our social media platforms, which is at Africo MHM, both on Twitter and Facebook. We are in the process of reviving our website, and we'll share soon, but right now we are active on both Facebook and Twitter. But you can also send us an email, acmhmsecretary@gmail.com.
Sorry about that. Okay. Sorry about that.
Sure.
Please always remember to put your microphone off.
Yeah. I have just posted.
Okay, thank you for that.
The chat box. Sure.
Great, because I was going to ask you to put it in the chat box. Okay, so just as we've had, thank you so much for that, Puleng. As we've had background on some of the challenges that young people face, and what the ministry is doing, what organizations are doing, and taking keynote of the already existing challenges that young women and girls face as regards menstruation, we also want to take note, just as Rosette mentioned, of the fact that we've gone so far, but now that the COVID-19 response presents new and unique challenges for girls and women, but no one seems to be talking about it, and it doesn't seem to be at the forefront of our response, at least from face value. So I just wanted us to have that discussion among the panelists. I know that Mary will be leaving us soon, so perhaps we'll start with her. What are some of the opportunities for advocacy that we have as regards COVID-19 response, and what are some of the challenges that exacerbated challenges that girls might face due to the COVID-19 response? Mary? She's still with us? Yes. Mary? Hello? Okay. I will, as we're trying to get a hold of Mary, perhaps I could pass the question on to Rosette.
Yes, what are some of the opportunities for us to advocate? I think there is a lot that we can do. One, the messages that are going out to the public. How can we take advantage of the different messages that are going out to be able to talk about issues of menstrual health management, even when we know that the people who are at the front line, majority are women, and our children and girls are at home? How do we take advantage of that to do some advocacy? And then two, I'm looking at a situation where we are providing other basic requirements amidst all this challenge, food inclusive, mattresses, soap, and everything. Can we have as a priority the issue of sanitary pads, so that if you're giving this home a bag of posho and beans, can you also ask them if they have any girls that can be of need of sanitary pads? I know if we did that and if we took out the messages, then we would have done something as stakeholders. From our side as Ministry of Education, we appreciate this is already a challenge, and we have included it in our messages that will go out to the public concerning the safety and security of our children. And how I wish all of us did something to make sure that this is not something that we are leaving it to the girls or the women, but it should be an issue that should be able to go to each and everyone that is involved in this fight against the COVID pandemic. Thank you.
Yes, thank you so much for that, Rosette. Mary?
Yeah, I would also like to highlight that currently different ministries are developing response plans to COVID. So it would be important that as key stakeholders, we ensure that aspects relating to menstrual health or hygiene are included in those response plans, because we know at a point in time that will influence funding, but also implementation. Then at organizational level, I know a number of organizations undertaking reprogramming of funds. So it's important that as we reprogram different activities, let us highlight and also plan for menstrual hygiene management interventions. Thank you.
Thank you so much for that, Mary. Lilibet? Lilibet, would you like to
opportunities for advocacy?
And yeah.
Sorry?
Yes, some of the opportunities for advocacy during COVID-19 response, and if there's any specific challenges that, you know, in your experience you see are being exacerbated by the COVID-19 response.
Okay, I think I'll start out with highlighting the challenges. In terms of the challenges that are going to pop up is that first and foremost on the economic systems and the public health systems, I think there's a kind of delay, or there's a potential blind spot, which Rosette had pointed out, in terms of how are these interventions, how might they overlook or even undermine the women's essential needs in terms of menstrual hygiene. So I think this is an area that all of us need to concentrate on. But some of the challenges, at least I did think of 3 challenges that I think are going to especially be evident during this time, is that first and foremost, with the different restrictions and the different restrictions set up, they just might be fueling the challenges that are already in place, that already face in terms of access to products. We're going to now see an effect that is coming from issues of closing of stores.
Perhaps that's what's causing the delay.
But now, with the restrictions being up and down, is that better?
Yes, much.
Much better. Okay, yes. So what I was saying is that all the travel restrictions and the self-isolation and self-quarantine, privacy is going to become scarce, or it is scarce, which means that it's then going to also heighten the come up with the strong taboos, the discriminatory cultures, and also affect our self-esteem. So now we're only looking at issues we now have to look at it in terms of it may have.
I'm so sorry,
the bleeding pattern, the premenstrual symptoms.
I'm so sorry. We seem to have really bad network with you. There's delays and we can't really get you clearly. So perhaps I'll bring you in later after hearing from Caesar as pertains to data. If we can speak to, of course, we already had a gap in MHM data pre-COVID, but then do we see that as a challenge even now, and how can we use data to even influence our interventions during COVID?
Thank you very much. But just one point before I delve into the data aspect on the advocacy issues that are arising from the COVID pandemic with regard to MHM. Hello?
Yes, perfect. Yes, we can hear you now.
Hello? Yeah, so I was saying one of the advocacy issues is around one of the advocacy issues is around the rising prices of essential commodities that we are witnessing during this situation we are in. And MHM products are one of the items that are susceptible to the rising prices in essential commodities. So we need to see how our governments are engaging the private sector to see how they can be regulated and not to increase prices of these commodities. Already we've seen that with sanitizers, with soap and the other items. And then water, the price of water is another. You know, water is very important for MHM because women and girls have to change, they have to keep hygienic. So the price of water also is critical, and also having an understanding that utilities have to sustain the service. So a win-win situation there is required, not to make water utilities collapse during the pandemic, but find a way of government subsidizing them to continue providing the water. And going into the question on data, during this period, I think we are acting on emergency situations. So right now, we cannot, again, be looking at robust monitoring systems, but perhaps utilizing the current technologies of data collection right from the community level, where we're seeing challenges on a daily basis. So how do we use simple technologies? Even WhatsApp, in one of the communities what I is working, we've encouraged our community advocacy groups to have WhatsApp groups that they collect data and share this information on a daily basis, information that we compile into our database. So how do we do that for the short term? But in the long term, we'll definitely have to work on a robust MIS system, a centralized MHM management information system, where data can be gathered, collected, and then translated to inform policy and decision making. So that will be very important for us. And then having within the different sectors that are working on MHM, having their reporting capture MHM. Of course, that will also require what Rosette talked about, the indicators. Having those harmonized indicators in place that feed into the MIS system, and then the sector reporting through joint sector reviews, capturing MHM challenges, and then informing decision making. So that is for the long term, and I think once we're able to do that, we'll be able to inform our programming based on evidence that we've generated through data collection. Thank you very much.
Thank you so much for that, Caesar. Now, just picking lessons perhaps from what other countries might be doing. Puleng, could you give suggestions to the discussion as well? Puleng, are you still there?
All right. Yes, I was just unmuting. Can you hear me now? Yeah.
Yes, yeah.
Okay, great. Yes, there's a lot of activity happening generally in the region, and what we have seen in the past few months mainly is the desire for partners and organizations within the countries to get organized through the launching of national coalitions, which I think Uganda is already a step ahead in terms of doing that, but also strengthening the coordination, even though in some instances there are those national coalitions, but it's about how they are managed, how they are sustained, and how they attain results and progress. And this has been mainly due to gathering political commitment in terms of the government also being a key player in the national coordination mechanisms, and being able to set the scene in terms of the development of policies and guidelines and strategies, which are then being implemented by the partners on the ground, who are then coordinated through the national coalitions, and in some instances being fed by regional coalitions based on the country setup. So that is what has been happening, and the results that have been attained in terms of policy implementation and development in some countries have been through the organization or organizing of partners to be coordinated, to be able to do joint advocacy and policy and strategy development and implementation, and being able to hold governments accountable for the commitments that have been made, either through the Agenda 2063, through the SDGs, because we are all aware that MHM cuts across several SDGs, and those we use to be able to hold governments accountable in terms of the commitments that they have made. And maybe just one last one is the example of the recent through the launching of the coalition in South Africa, but even before then, the advances to develop an M&E framework for the national MHM program. That was such a welcome initiative, because one of the key challenges in the work that we're doing in MHM are the limited indicators and general M&E being able to track progress and document lessons. So the development of that national M&E framework has been a very welcome development, because it enables all partners to be able to work towards a common goal and be reporting towards the same progress indicators, impact, and so on. So that is one of the recent exciting lessons that we have documented. Thank you.
Okay, thank you, Puleng. We seem to have lost you.
Oh.
Okay. Okay, thank you so much for that. We will be getting into the questions that have been posed shortly. Please go ahead if you have a question to clearly set out who the question is. So it's two, so I can be able to forward it to them. Just as a quick summary of what we've discussed, it's been clearly highlighted that girls and young women are facing challenges as regards menstruation, and there needs to be more coordinated work by us, civil society organizations, and the private sector as well as the government. We just need to have one coordinated voice towards and action towards ensuring that girls experience their menstruation with dignity. And just as Puleng has pointed out, without having progress in MHM, we will not be able to clearly meet the SDGs, the country SDGs, with regards to health, education, access to water, gender equality, and so many more, including economic empowerment. But this progress cannot go on if it's not documented. So also the importance of data has been highlighted. As regards COVID response specifically, it's been emphasized the need for us to do something now. I think we're even late. But as CSO organizations passionate about women's rights, we need to push it to the forefront of the response that different ministries are coming up with, but then also in our messaging on COVID, as well as using simple, like Caesar pointed out, simple data collection through WhatsApp or all the different portals that we have, and then also ensure that we gather political commitment and hold our leaders accountable. Yes, so thank you once again to our wonderful panel for the very elaborate discussion on MHM, and I know there's so much more that we could have said, but just because of time, that's why we only have so much. But thank you so much, it's still as impactful. So getting into the questions, I will address each question to each speaker. If we could address the questions in 1 to 2 minutes, that would be wonderful, so we can be able to hit everyone's questions. There's a question that's been addressed to, I think it was Mary, but I see Mary is not on the call, so maybe Rosette can answer. The challenge, we recognize the challenge with having female teachers in schools as a reality that we face. What would be practical alternatives to ensuring that girls are supported to get the information they need? Rosette?
Thank you very much.
So the question is looking at the challenge of female teachers.
And the challenge of female teachers, and we appreciate this is a challenge. But as a sector, we have been able to develop simplified resource materials that can be used by our children at any age to understand what menstruation is all about and how they can be able to manage it. In addition to that, we've been able to build the capacity of our teachers, not only the senior women and men teachers, but all other teachers to be able to appreciate what menstruation is all about. Because even in an event where there is a female teacher and the enrollment in the school is over 500, you of course need another teacher to be able to support. So we've been able to empower our teachers to be able to talk about this subject. And then the aspect of integrating it in our curriculum, I think it gives us an opportunity to be able to talk about it without any fear. Any teacher can come into the class and talk about menstruation without fearing. In addition to that, our parents, through the teachers association, the parents teachers associations, and the school management committees have also been equally empowered to talk about menstruation with our children when they are not with us. For example, during this period when they are at home, who is talking about the issues of menstruation or the issues of growth and development? It should be this parent. So we've been able to reach out to a number of communities to make sure that the parents can equally talk about this subject. Thank you very much.
Thank you so much, Rosette. Since I still have you here, maybe I should pose there's another question that's here for you, and it's looking at how we can motivate senior women teachers so that they can be able to work effectively. So it's a follow-up question to
motivation of senior women teachers.
The one above.
Okay. What we are doing is the motivation comes in different forms. Sometimes when we talk about motivation, people go straight to the financial motivation. But being recognized that you are a senior women teacher, it is a very important thing within the school. So what we have been able to do as a sector, initially even our senior women teachers didn't know what to do. So we've been able to develop guidelines for them to know what their role entails and how they can be able to work out with other communities and work out with the teachers to make sure that they talk about this issue. Motivation, when they are doing their work, the head teacher, who is the head of the institution, there is a way they motivate them, they recognize them. It may not be financial resources, but at least they are recognized because of the work they are playing. And I think for me that is enough to motivate them. Hello, I don't know whether I've been able to answer you.
Okay, thank you so much for that. Yes. Yes, I think it's been clear and to the point. I see that Doreen is also asking based on that question. No, she's adding that to your answer, and she says that another way to motivate them is by using they're very good in the languages. Okay, I'll let her finish typing. Lastly, based on the coordinating committee that sits at MOE, the question is asking, how can an organization join?
Like Willem has already shared, it's an open invitation. Well, once we get to know your number, I can maybe share my email so that next time when we have a meeting, you can be able to join us. We have membership which is open because it's a coalition. So it is easy. You can share my email address and people can be able to get the contacts and we get in touch.
Okay, thank you. Thank you for that, Rosette. I'm sure someone from our team will share that on a thread. Going to Puleng, there's a question for you from a participant from Cameroon, and she wants to know if there are connections in Cameroon that she can work with, that you could connect her to. Hello, Puleng? Hello?
Yes, okay, now I'm unmuted. Can you hear me now, yeah? Yes?
Yes,
You
we
can
can
hear
hear
me?
you. Yes.
Okay.
We can, yes.
Yes, we do have actually quite a number of organizations in Cameroon who have already are members of the African Coalition, and what we are trying to do with them and several other countries who have not yet organized themselves in terms of a coordination structure or even just knowledge sharing and lessons sharing is to get them organized, and with the support of the possibly UNFPA country offices within the countries that we work in, or even if there are other active partners who are already leading some coordination efforts, we do encourage them to continue and organize themselves through those. But I can share with her a list of members from Cameroon, and I'm trying to look at the chat box whether she had shared her email address, but if not, then we can always link through you guys, and then I can share with her a number of organizations in Cameroon who are already members of the coalition. Thank you.
Okay, thank you so much for that, Puleng. I'm sure she's going to respond to that, and hopefully you can be connected and get more information.
Yes, she has.
Susan is, she has, okay, great. Susan's question is targeted to CSA, and she says that wash issues are already a challenge in rural schools, and even though the basic, hand facilities available, water is still scarce, and sometimes it's only available when there is inspection. She also points on the fact that availability of changing rooms is challenged by the lack of water. How can we be able to work on this? Caesar, that question is yours.
Yes, thank you very much. Very interesting question. It's a systems strengthening question, I believe, because as you can imagine, water provision or water supply is usually a mandate of another sector in many countries. So you're supposed to provide water for a school, but that service is provided by a different sector, much as they are all government institutions. And that's where the challenge has been, getting government institutions to the same table and discuss and agree on these challenges and make contributions. So in Uganda, we had the three ministries, line ministries, water, health, and education, come up with a memorandum which didn't also perform quite very well for sanitation and, of course, issues of MHM. So it is really about government prioritizing these issues and planning, joint planning, and also providing commensurate budget allocations to provision of water services in schools. Unfortunately, Ministry of Water has been trying, but Ministry of Education is under-resourced so much to the extent that they cannot provide these services themselves, and most of these schools go without water and even other essential products for MHM. So in terms of sustainability of how this can happen, it's not just rural schools, even urban schools. Much of the advocacy we've had in urban was to ask the national utility, that is National Water and Sewage Corporation, to have a special tariff, like a proper tariff for public schools, a reduced tariff that would help them pay their water bills. And that has been challenging because from a business perspective, the utility says they will be making a loss. But on the other hand, they have to meet the needs of the girl child in school. So where is the win-win situation? And these are conversations we need to have between government institutions to sit together and find the solutions. Thank you.
Hello? Hello, can you hear me? I seem to have dropped off the call.
I'm
Sorry
getting you.
about
Hello? Hello?
We can hear you. We can hear you. Go ahead.
Yes, my name is Andrew from Soroti.
Yes, who's this?
I was saying my name is Andrew.
Okay,
Hello?
great.
Hello?
Yes, Andrew.
Yeah, my name is Andrew. I work with a community-based organization called Youth and Women for Opportunities Uganda, supporting women and girls who have been giving out sanitary towels to the rural community in Serere and Soroti, especially reusable sanitary towels. And then also, the challenge of water has been an issue. Our organization is through funders from the US. We also try to provide some water, both at the school and also at the community, by piping the community systems to avail water for the girls so that they can have a little time in the boreholes to avert rape, and then also have some water for general hygiene at home. I'm glad that though I came in late, but also I want you people to loop us into the coalition and also work with us. Currently, we are doing a COVID intervention here for targeting the girls at their homes, right? But we are working within the environs of their schools to try to link them up and sensitize them on the general cleanings. The periods cannot wait for the pandemic to stop before they can continue. So we're trying to work with Africa to avail them again.
Okay, thank you, Andrew.
I'll be happy to link up with you.
Okay, thank you so much, Andrew, for that, and thank you for your great work. Yes, please put more information on the chat because it makes it easy for us to follow up. Yes, so we do have a good number of questions, but unfortunately our time is fast spent. We're still going to stay in touch with all the panelists because we really feel like, especially now and also looking towards MHM Day in May, we want to have better coordinated work and what at least impactful work as different CSOs that are working in MHM. So we will find a way to address the different questions that have been asked, or at least forward them to you who has ways forward. So once again, I just want to say on behalf of UAF as well as the Ministry of Education and Sports, I want to thank you so much for being a part of this webinar. I just want to loop in the panelists to just give a short 1 minute in closing, something that we can take away from this webinar. I will start with Rosette, please.
Thank you very much, everyone, for your active participation in this webinar. We look forward to working with all of you as a Ministry of Education. The coalition is open, and like we said, we need to strengthen it further to make sure that we are able to support our women and girls to go through menstruation with dignity. As we warm up for the May 28th International Menstrual Health Day, I call upon all of us to work together to be able to contribute towards ending period stigma. Thank you so much.
Thank you so much for that, Rosette. Lilibet?
Can you hear me okay?
Yes.
Thank you everyone for joining us today. I just want to remind us that periods will not stop for pandemics, and neither should we. So we should all work in our different sectors and our different capabilities to make sure that we keep MHM as an integral part to all the work that we do that we can improve policies, research and design, those cross-sectoral programming, and advocacy for MHM. Thank you very much.
Thank you, Lilibet. Thank you for joining us. Caesar?
This very discussion. I think for me, the issue is really to amplify the voice around MHM, especially during this period of the COVID-19 pandemic, but not forgetting the what happens next after COVID. So I believe the voice needs to come out strongly, but also sustain it beyond COVID. Thank you very much.
Thank you, Caesar, for that. Puleng?
Thank you very much. I'll just summarize with just 4 words, which are documentation, to say a lot is really happening and partners are doing a lot on the ground, but we are unable to learn from the great lessons and some challenges and mistakes that we've done in the past to be able to move forward. So I'll end it with the documentation, collaboration, coordination, and context, to say whatever that we do should be within the context that we live in. Yes, we are sharing lessons across countries, across communities and continents, but the context is really key in order for us to be able to empower those who menstruate, for them to be able to address the challenges, the MHM challenges that they are facing throughout their reproductive life cycle. Thank you.
Thank you so much, Puleng. And once again, I just want to thank our panelists for being a part of this discussion. Unfortunately, Mary dropped off. She seems to have had some internet issues, but it has been such a rich discussion. And thank you so much to each and every one of you for having girls at the center of your programming and at heart. As you all know, World Bank reports over 500 million women and girls lacking adequate facilities for MHM. Therefore, our promotion of MHM is a positive step towards ensuring that every girl and every woman is able to live a life with dignity, bodily integrity, and overall their life opportunities are improved. So we hope that this discussion will continue on the social media pages that have been shared. Please feel free to go there if you have any thoughts on what more we could discuss as regards MHM. And we surely have not stopped here. This is going to be a series as we continue to discuss key SRHR issues, including MHM. In fact, just as a keynote, we have a webinar planned for next week, and we will be reaching out to you on the topic and how to join that meeting. We hope that we can have you during that webinar as well. So I think with that being said, I would like to close this webinar, and thank you all once again for being a part of it. Stay safe and have yourself a good evening.
Thank you.
Thank you
Thank
very
you.
much.
Thank you. Thank you. Have a good evening.
Unmuted. Have a good day. Thank you.
Thank you. Bye.
Bye. Bye. Thank you.
Thank you. Bye, everyone.
Keep safe and make sure you social distance.
But people are dropping like corona. Please stay safe.
Okay, I'm going to just end the call now.
Okay.